very precious. The sign of being alive is the continued pumping of your heart, and when your heart stops beating, you can get into a cardiac emergency. A medical emergency may occur at any time to any person, and as per the World Health Organization's census statistics, mortality due to cardiac causes has overtaken mortality caused by all cancers put together. Now, as per the WHO, approximately 4,280 out of every 1 lakh people die every year from sudden cardiac arrest in India alone. The concerning change in recent times is that the onset of heart disease is now seen at a younger age, especially in people who are in their 30s and 40s. The biggest reason for heart-related deaths is a lack of awareness as to what needs to be done in a cardiac emergency. Now, every adult should know which conditions qualify as a heart-related or medical emergencies. The best one can do is to learn beforehand the actions required in case of a cardiac emergency. Now, life-saving techniques such as CPR give you the power to save a life. It has been proven that bystander CPR improves the rate of survival by almost 50%. It's even more important if you have a loved one who has a history of cardiac disease, as research reports that the majority of cardiac arrests occur at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. Joining us on the broadcast, Dr. Chandrakant Kadam, consultant cardiologist at Heartbeat Multispeciality Hospital in Ahmednagar. Also on the broadcast with us, Dr. Gajendra Agrawal, consultant interventional cardiologist and professor and HOD at JNMC Sawangi Wardha Heart Care Clinic in Nagpur, and Dr. Hemant Khemani joining us, who's a consultant interventional cardiologist, Heart and Mind Clinic in Mumbai's Borivali. Dr. Agrawal, do men and women experience the same symptoms associated with heart disease?
The symptoms of major heart attack are, majority of the symptoms are similar. However, women have some different set of symptoms. Like they have more of atypical symptoms like chest, rather than chest pain, they may have chest discomfort, discomfort in jaw, or choking sensation in the throat, breathlessness on walking. These are more common in women compared to men.
Right. Dr. Khemani, what is the link between cholesterol and heart disease? And if the body makes its own cholesterol, why does the diet matter so much?
Yeah. So as we are all aware, cholesterol, I think everyone is aware of this, cholesterol is a risk factor for heart disease. With high cholesterol, you can develop fatty deposits in your blood vessels. These fatty deposits eventually grow, and it makes it difficult for enough blood to pass to your arteries. So when this occurs, the blood flow to the heart is compromised, and the patient will start complaining of breathlessness or chest pain whenever he performs any activity which requires more blood flow. At that point, the patient will get chest pain or breathing difficulty. Now, it may occur so that suddenly one day this blockage which has formed because of the cholesterol, it may rupture and form a clot. That day the artery gets occluded completely and the blood flow to that part of the heart is stopped completely. And this is what leads to a heart attack. And it is an emergency. So our eventual goal is to prevent the heart attack, but before that we want to prevent any blockages from developing. And if you have seen the studies, it has been seen that the blockages start to form right from the second or third decade of life. So we have to be careful what we eat, because of course the body makes its own cholesterol, but this cholesterol gets absorbed. These substances which eventually form the cholesterol, they are absorbed from the food which you eat. So if you eat food which is high in lipid content, especially fried food, cheese, butter, ghee, maida, all these food items can lead to the higher production of cholesterol. Some part of the cholesterol of course is required for nerve conduction and other purposes, but the excess cholesterol then gets deposited in the arteries and leads to all these heart problems.
Right. So with high cholesterol, you can develop fatty deposits in your blood vessels, as doctor has just made it clear. And eventually these fatty deposits grow, making it difficult for enough blood to flow through your arteries. With that, let's revert to Dr. Kadam. Dr. Kadam, can heart problems start at any age? And which heart problems can occur at a younger age?
In India, age is more important risk factor for heart problems. In India, heart attack occur mainly between the age of 25 to 69 year of age. Out of that, 50% of attacks occur below the age of 50 and 25% attack occurs below the age of 40. In India, the heart attack occurs almost 10 years earlier as compared to Western populations.
Right, so while most heart attack victims are middle-aged or older, the truth is that heart disease can affect anyone of any age. With that, let's go across to Dr. Agrawal. If a person doesn't smoke and the cholesterol is within normal limits, what impact does the family history of heart attack have on the risk, Dr. Agrawal?
Family history is definitely important. The heart diseases are primarily multifactorial diseases. The family history, lifestyle, lack of exercise, all these factors impact the causation of heart attacks or for that matter, all kind of vascular diseases. However, if the family member, because many of the genetic diseases runs in family, like some genetic diseases are associated with high cholesterol levels, like familial hypercholesterolemia, familial hypertriglyceridemia. These runs in family and they predispose us to the causation of heart attacks or strokes. Second thing, many of the diseases which affect your muscles, like muscles in your blood vessels, like vasculitis syndromes and other things, they can also run in family and they predispose the members in the family for coronary heart diseases. Apart from that, various other diseases like obesity, which runs in family, can give rise to heart attacks. Hypertension, which runs in family. So all these genes causing obesity, heart attacks, hypertension, hypercholesterolemia predispose people to coronary heart disease and cardiovascular disorders for that matter. So if you have a very strong family history for coronary heart disease, many of the first degree relatives or second degree relatives are having this kind of problems, you have to be more careful. You should start lifestyle modification at early age. You should screen yourself regularly, and the screening should start from early age, and you should modify your lifestyle very aggressively in this scenario.
Right. Now, another crucial aspect is stress. Dr. Khemani, we all know that emotional stress can be harmful to our brain health. Can emotional stress cause sudden cardiac death?
Yes, so now this is a very important point, and many people are not aware that stress does not only affect your brain, it affects many parts of your body, especially your heart and the cardiovascular system. The effects of mental stress on cardiac ion channels, which control the heart's electrical properties, can precipitate sudden cardiac death. So in sudden stress, the cardiac ion channels get activated, the heart rate goes on to become very fast, and the heart may completely stop beating, and this can lead to a cardiac arrest. Secondly, like I just described previously, the blockages which have been formed because of cholesterol over the many years, they can suddenly rupture one day because of stress. This emotional arousal can also lead to life-triggering and life-threatening arrhythmias and can again lead to sudden cardiac death. So, many times we must have heard that patients get into arguments or they hear some sad news because of which they get a heart attack. So these are the mechanisms behind this sudden stress leading to cardiac arrest. Also, one more important point is long-term stress can lead to high blood pressure, which can pose a risk for heart attack and stroke. Also, this stress may eventually lead to diabetes also. It can lead to stress eating, obesity. Then people in stress, they tend to smoke more, they tend to consume tobacco more, which again are risk factors. So overall, mental health is also very important.
Right, so stress may lead to high blood pressure, which can then pose a risk of heart attack and stroke. Now, Dr. Kadam, is it true that taking fish oil capsules lowers blood cholesterol levels? And which type of food helps to lower blood cholesterol levels?
Yeah, fish oil are important component of our diet. Fish oil are very rich sources of omega-3 fatty acids. Omega-3 fatty acids are the acids which help in oxidation of triglycerides. So by oxidation of triglycerides, omega-3 fatty acids tend to lower our bad cholesterol level. So using fish oil daily in the diet is helpful because it decreases the blood cholesterol level and help in decreasing the risk of heart attack. Second thing is that regarding the diet, we should eat healthy diet for decreasing the risk of heart attack and coronary artery blockages. So in our diet, we should decrease the amount of the fats which we use in our diet as well as decrease the salt intake by almost 50% of the daily intake. So less salty and less oily diet and less spicy diet. This is more important regarding the dietary modification to prevent the heart attack. Second thing is that we should increase the amount of fruits and vegetables in our diet. We should add more pulses, cereals, and fiber in our diet. All these help to decrease the absorption of cholesterol from dietary food into the blood, which help in decreasing the body cholesterol level and thus decrease the risk of heart attacks.
Right, Dr. Kadam, they're asserting that there is strong evidence that omega-3 fatty acids can significantly reduce blood triglyceride levels. Now, on that note, we're stepping into a quick break. Our experts stay on with us to help you understand sudden cardiac death and the role of CPR to revive and save a life. We're back with experts who are here to help you understand sudden cardiac death and the role of CPR and guide you regarding what needs to be done in a cardiac emergency. Let's rope in Dr. Chandrakant Kadam. Doctor, what steps should a bystander follow if they recognize that someone is having a cardiac arrest?
So, whenever there is a sudden cardiac arrest, CPR is a immediate treatment for that. So, it is just a basic life support. CPR is done by any person whenever there is any sudden collapse and the person feels that there is a cardiac arrest. CPR should be started immediately because this is the most important for survival of patient. CPR is a basic life support, so it may CPR may try to maintain the blood supply to the vital organs like brain and heart till the definitive medical help arrives. So any person can give CPR. Second thing is the CPR consists of chest compression and respiration. It is generally with the ratio of 30:2. That is 30 chest compression with 2 respiration should be given whenever there is a single person resuscitating the collapsed person. CPR is a basic life support. So it is important that it should be done immediately when there is any cardiac arrest. There is no need that whether the person is trained or untrained. It is always better to do something to survive the patient than doing nothing. So CPR training should be done for laymen as well as paramedical persons. For the CPR training, various workshops should be arranged and CPR should be, the general person should be trained regarding giving CPR to any collapsed person in out of hospital whenever there is a cardiac arrest.
Right. So picking up on what Dr. Kadam has said, what if the person recently underwent an open heart surgery and has had a cardiac arrest? Can we perform CPR on such patients, Dr. Gajendra Agarwal?
Yeah. A patient who has undergone bypass surgery, you can have 2-3 scenarios. A patient who has undergone surgery a few years back, a patient who has undergone surgery a few months back or a few days back, or in a day or two in the hospital itself. In these scenarios, the CPR we give in the case of cardiac arrest. But if you consider consider from our point of view, there are various reasons for patient to have a cardiac arrest and become unconscious. Sometimes the heart beats drop suddenly, may become 0 or go to very low levels, or sometimes it can be so high that you hardly see heart beating, like 300, 400, 250 like that. So in both scenarios, CPR is mandatory. It is not irrespective of whether when patient has undergone cardiac surgery, you have to start CPR because it is the only thing which can save life in both the situations. Either heart rate is very slow or have stopped, or heart rate is very high, maybe in the range of 250, 300 or 350. Patient who has undergone surgery few days back, though his chest wounds have not healed, the chest is joints are still open. It is not a contraindication for CPR. You should start CPR as soon as possible, like my colleague has said, and immediately call for emergency support. You have to continue CPR till the time emergency supports arrives. As soon as ambulance is nearby, you can shift patient in ambulance. Apart from that, there is also role of chest thumb. Even if patient have undergone surgery, immediate severe blow to the chest, chest thumb, we call it in our language, can be a life-saving in the patients who have undergone bypass surgery. If patient has undergone surgery a few years back, then definitely you have to give CPR in that scenario also.
Right, lots to unpack there. With that, let's also bring in Dr. Hemant Khemani. Doc, what precautions should existing heart patients take while traveling?
So now this is a very frequent question that we get as cardiologists. Okay, whether now the patient will be able to travel, to go abroad, whether they will be able to visit his village or not. So the most important thing that we should remember is that most patients with a heart condition or a circulatory condition are able to travel and are able to go on a holiday. Of course, it is important that we avoid traveling during the first 1 month post any heart surgery, post angioplasty, and post a heart attack. At least for 1 month, we should avoid any traveling unless and until it is very urgent. Post open heart surgery, of course, it may be longer, also 2 months until the wounds are healed. Otherwise, you may develop an infection also. You will require frequent follow ups with the doctor also. But otherwise, patients who are stable, who have had heart attacks in the past, or who have just a heart condition and they are on regular medications, they can safely travel. Now, the important precautions that have to be taken is, okay, suppose you are planning to go on a high altitude, you should visit your cardiologist or your physician and take the appropriate advice. You should avoid going to very hot or very cold environments. Also, you should avoid destinations which are having heavy air pollution. Now, it is important that whenever you go to any hospital, to any holiday destination, you should carry enough number of medications so that they should last throughout your holiday. In fact, I always recommend you carry excess tablets. So, suppose you have to extend your duration of stay over there, the tablets should not finish. Because many a times while traveling to another city or another destination, you may not get the same tablets over there, and missing heart tablets is not at all allowed, because if you miss any tablet, you may again precipitate a heart event. So also it is important that you keep a up-to-date list of all your medications in your purse or wallet. You should carry a note from your doctor. Suppose if there is any emergency while traveling, so the doctor over there at the new destination, he may be able to go through the notes quickly. You should carry your emergency numbers with you. You should inform your relatives. Ideally, always a relative should be accompanying you. So suppose if any emergency is there, so he may accompany you to the hospital.
Right.
But overall, it is quite safe for them to travel.
Right. So existing heart patients should avoid extremely hot or extremely cold environments, and they should avoid environments with heavy air pollution, is what doctor is saying. Also, talk to your doctor if you are planning to travel to a high altitude if you have an existing heart condition. Dr. Kadam, now what is the relationship between insulin resistance and heart disease?
Basically, insulin resistance is a state when the level of insulin in the body is either normal or above the normal, but the insulin is not able to act at cell level. That means their failure of insulin to control the blood glucose level, despite there is normal or above the normal insulin level. Insulin resistance is a major part of a syndrome called as a metabolic syndrome. Metabolic syndrome is a group of diseases arising because of insulin resistance, and it consists of mainly hypertension, central obesity, progressively leading to diabetes. So insulin resistance is associated with weight gain, and as the weight gain increases, the amount of adipose tissue in the body increases, which further leads to insulin resistance as well as increase in the body cholesterol level. So insulin resistance leads to weight gain and obesity. Obesity predisposes for development of diabetes, and weight gain also increases the blood pressure causing hypertension. These all triad, that is obesity, hypertension and diabetes. All these causes the damage to the vessel wall, and it leads to increase in the blockages, leading to more risk of heart attack. Further, insulin resistance is directly associated with increase in body bad cholesterol level. So by increasing the bad cholesterol level, insulin resistance also leads to coronary artery disease and heart attack. So insulin resistance directly increases the risk of heart attack, as well as it promote development of various factors like diabetes, hypertension, which also leads to more heart attack.
Right. Thank you so much, doctors, for all your advice and for busting all these myths. We hope these experts were able to help you understand sudden cardiac death and the role of CPR to revive and save a life. Thank you for investing your time. Thanks for watching. Goodbye.